The most common injury to the collarbone or break in the collarbone happens right in the middle of the bone. Clavicle fractures, clavicle or the collarbone, is one of the most commonly broken bones in the human body. It's pretty obvious. It sort of sits out there. It's vulnerable in many ways to injury and trauma, and we just see a lot of them. It's a super common injury from falls, whether it's falls outside, playing soccer, sports, mountain biking, but people break their collarbone walking down the street, basically. It can be a very simple injury and it can be a sort of complicated injury. The most common injury to the collarbone or break in the collarbone happens right in the middle of the bone. And many of those can be well treated just with a sling and a period of rest and some follow-up physical therapy. They heal on their own in most cases, and those typically affect younger patients, adolescents, teenagers. Once you start to get into higher energy injuries, as we call it, meaning patients that are falling at speed off of a mountain bike or a motorcycle or skiing or contact sports, rugby, this sort of thing, you'll start to see the collarbone fractures that occur in more pieces or shifted more out of position. And those we predominantly are treating with surgery. Surgical repair of the collarbone means that we can put the pieces back where they're supposed to be and get them to heal more accurately and more reliably. And what that means is it feels better quicker, less pain actually, than waiting for it to heal in a sling. And more importantly, ultimately their outcome is more normal because the bone is put back where it's supposed to be. The collarbone basically works as a strut or a cantilever. It holds your shoulder in place. And when it heals in a position that's awkward, either out of place or shortened, it can really affect the long-term function of the shoulder. And undoing a fracture that's healed poorly is much more difficult than putting a fracture back together in the first place. So we, again, encourage people, if they've been told they have a collarbone fracture, they should come in and let us have a look at it. Some of them can be treated very easily in a sling with no further interventions, but more and more these days we're leaning toward trying to make them as good as they can possibly be for longer-term successful outcomes. Someone who's broken their collarbone, it's not a subtle injury. They know something happened. Most folks end up at an urgent care or the emergency room. They're given an x-ray and they're told, oh, you broke your collarbone. Okay. So what should they really do next? Well, collarbone fractures hurt a lot. And obviously, resting it, icing it, that's the first aid or the first step for treating it. In most cases, they're not true emergencies, meaning it doesn't need to be taken care of in the middle of the night. But they should be seen expeditiously. If someone calls our office, we want to see that person within a day or two for the broken collarbone because we want to assess it and make plans that if it needs to be repaired surgically, we want to get that done, again, in a timely fashion. You can repair collarbone fractures within 2 or even 3 weeks of the injury, but every progressive week, it gets more and more difficult to do an accurate and a good job. So from my point of view, if someone calls the office and they have a collarbone fracture, I want them in within a couple of days so I can talk to them about it, see what we need to do, if we need to do any further tests like CAT scans to see the shape of the pieces, the fragments, or any of those kind of testing, that we can get that done and get them in a place to have it repaired sooner, not later. So while it's not an emergency, it shouldn't be the kind of thing where it lays around for a few weeks and then it still hurts and then you come in. It should be seen more urgently than some other things. So again, collarbone fractures really come in a lot of different shapes and sizes, and there is no one-size-fits-all approach. Again, it's an individualized circumstance. You cannot do this by just looking on a computer and figuring out what kind you have. There's the location of the fracture within the bone itself, the number of pieces, the shape of those pieces, where they're located. Some fractures can behave in a very innocuous way. There can be hairline cracks or even things that are completely not displaced, meaning that they should heal well without any intervention at all. And then there are fractures that are complex either because the number of pieces or the location in the bone that's more sensitive. There are ligaments, particularly as you get to the more outer edge of the collarbone, that can be involved. And some of those injuries are fairly complex and need not just bony repair, but ligamentous repair. All of those things are manageable, but they need to be addressed in a very specific way. They need the right kind of evaluation in terms of exam, the right testing to figure out what they are, whether it's CAT scans or MRIs or simply x-rays. And you need someone with skill and experience to know when the injury is complex versus when the injury is simple.